This is an instructional video on how to measure the abdominal aorta. The goal of this exam is to visualize the entire aorta from the diaphragm to the bifurcation located approximately at the level of the umbilicus. Turn on the machine by pressing the button in the upper right-hand corner. Press the exam button in the lower left-hand corner of the machine. Then you will select the curvilinear probe and the adult abdomen setting. And once you're on that, you press the set button that's above the trackball. Press the patient button that's in the left-hand side, and then enter in the patient information provided to you during this study. Afterwards, bring your cursor down to the OK button, and press the set button just above the trackball to press OK. Apply a generous amount of gel to the abdomen. Select the curvilinear probe. Have the marker facing the patient's right-hand side and start at the xiphoid process. During your exam, you'll notice a couple things. One of your landmarks will be the spine shadow. So the spine shadow has this white rim on top and a shadow casting behind it. Right in front of the spine will be, on the right hand side, will be the aorta. You may also see the inferior vena cava if you're not applying a lot of pressure. But if you notice, when you apply a lot of pressure to the belly, the IVC collapses, but the aorta does not, and that's one good way of distinguishing which one is which. Optimize your picture by adjusting the depth, which is in the lower right-hand portion of the machine, so that the spine is just on the lower part of the picture. Okay. Now adjust the focus position located in the upper part of the machine so that the focus position, that is the arrow on the right hand of the screen, is right at the level of the vessel. Keep the probe perpendicular to the patient. Start just below the xiphoid process and gradually make your way down, visualizing the aorta the entire way. At about the level of the umbilicus, the aorta will split or bifurcate, and you need to reach this point to complete the exam. Some landmarks that you may see but you do not have to see for completing the exam is the seagull sign, which is seen up here, and that's the celiac trunk that then bifurcates in the hepatic and the splenic arteries. Farther down, you'll find something called the mantle clock, which is this white rim around a vessel that's right above the aorta, and that is the superior mesenteric artery. Now we're going to track the aorta down farther. As you notice, it will get closer and closer to the surface. If you're going to make your measurements here, you'll want to adjust your depth. And as it comes down, you want to get all the way until it splits. As you can see right here, now you're seeing it splitting right here. We'll bring it back up briefly to show you it together, and then it splits. Like that. Good. And then that's when you know that you've hit the end of your exam. If the aorta, as you go through your exam, tends to get smaller as you go down towards the patient's feet and doesn't have any areas of enlargement, Then go back up towards the patient's head as far as you can go, because this is where you're going to find your max aorta measurement. In order to take a measurement, use the freeze button in the lower right-hand corner, and then use the trackball to get the image that you would like to measure, which will be the maximal diameter of the aorta. Once your image is in view, then you want to press the measure button, located right above the trackball. It will bring up a caliper that you're going to place on the outside wall of the aorta. And then you're going to press the set button. And that will set the caliper, and then you will bring the caliper down to the other side of the aorta, again on the outside wall, and press set again. And this will be your first measurement. That will be the AP measurement from the top to the bottom, but you also want to do the lateral measurements from side to side. In order to do that, you have to press the measure button twice, and then you'll bring the caliper to the outside wall of the lateral side, press the set button, and then you're going to bring it to the other side of the wall and press set again. And then once you're done, press save and write down the numbers as you are instructed in the study. The goal of this exam is to find the maximal diameter of the abdominal aorta. And this is a screening exam. If the maximal diameter is below 3 centimeters and you have visualized the entire aorta from the xiphoid process all the way down to the bifurcation, then your study is complete and is negative. If you find an area where the maximal diameter is over 3 centimeters, then this is considered an aneurysm and should be sent for a further study. In this specific study, the aorta is above 3 centimeters and should be sent for an official abdominal aortic aneurysm screening study. Keep in mind that this is a screening study for the diameter of the aorta. It does not specifically look for dissection or thrombus or anything else that may fill the lumen of the aorta. You do not need to be concerned with the contents of the aorta for this specific study. What you need to be concerned about is simply measuring outer wall to outer wall. Things such as calcification of the wall can sometimes blur the lines of the wall and sometimes make it appear as if there's thrombus inside of the aorta. For this specific study, again, all you have to do is measure from outer wall to outer wall. However, if there is concern or if you are unsure about your measurements, you should refer out for an official AAA screening study. When you're done with the exam, press the End Exam button in the lower left-hand corner. Sometimes it is difficult to visualize the spine or other landmarks that help you identify the aorta. If you would like to ensure that what you're looking at is the aorta, you can center it on the screen, turn your probe 90 degrees with the indicator towards the patient's head. And here you can see the thick-walled aorta in a long axis view, and it appears to be pulsating. This is an example of the aorta in long axis. You can see the thicker walls, and actually here you can see a little bit of the spine that it runs along. And one thing you have to be careful of is that this is not the inferior vena cava, so this should not collapse with pressure of the probe, as this one doesn't. Don't be fooled by larger individuals. Don't set your depth too deep. Even in this larger individual, you can tell that The max depth here on this side reads only 10, or maybe it goes down to 12, but you really very rarely need to go much more than that. During this exam, as we move through the aorta, you can see that we run into some shadowing here created by bowel gas. And this is what bowel gas will look like. It will block your view of the aorta. And this is when you know that you need to use some of your techniques to try to get the bowel gas out of the way. If bowel gas is noted in the upper aorta, you can ask the patient to take a deep breath and hold to try to displace the gas. If gas is noted lower down, apply firm pressure for 10 seconds to try to displace the gas. If this does not work, then release the pressure and reapply if needed. You can also try to slide the probe towards one side of the patient to try to get around the gas. In this point, you would be angling back towards the aorta. You can also have the patient try to lay on his or her left side to try to get the gas out of the way. Finally, the patient can drink a large glass of water to try to displace the gas in the abdomen.